to really think through how we're going to formulate something new. So, all of these agencies do really great work. I think they all have said they don't have the capacity at this point to become a 911 response. Some have even said, the Y said that is not what they do. I am, as I said earlier, not really comfortable kind of outsourcing our 911 response to other agencies. I think Kristen's points in terms of, kind of merging another agency or having an MOU with another agency to represent Evanston has a lot of dynamics that we probably don't know about from our seats. And the 911 response is really vital. And I'd hate for that and all of our good intentions to get lost because our 911 dispatch doesn't gel with,
right,
whatever things might happen that we don't know about in all of our good intentions. So I would really love, and I would propose for us to think through this kind of new 911 response to come out of our health department. So similar to our victim services, but actually, trained to do more than what victim services does. Our health department, I looked at the org charts from years past when it was, big and thriving and had lots more services. I think it has capacity with, the right staffing and management to house.
You mean putting the whole 911?
Well, I don't know. I mean, I think maybe we'll look at that, but I don't know in terms of the 911 dispatch. I mean, in terms of this response. So I looked at a model that I can share with you guys, and they had kind of a crisis response team. They worked in the 911. So a little bit like Cahoots, but they didn't work in a separate health department. They worked in a kind of city health department. So there was a manager who obviously was credentialed and licensed and all those things. And then they had a staff and they worked, in the health department. I don't know if they were actually at the police department or not, but they responded to 911 calls. So as Kristen mentioned, I think, we have to be really mindful as well, having the right staff, but then having them to be able to respond without the police. Because if we're talking about people who are in a variety of states of, mental and emotional health, physical abuse, and we don't know what their, history is per se, if our 911 dispatch is able to say, hey, we need a crisis intervention person here, that person can go and see and assess. And if they decide, okay, we need a fireman, we need a paramedic, whatever they might need, they can call for that. But I think having the right staff to be able to respond out of the health and human services, because we are providing a service to our, in that model, to me makes a lot of sense versus kind of this outsourcing. And particularly as Maureen mentioned, we need kind of a continuum of care thought that all these agencies, we're going to need them to be there to kind of have us be able to refer and pass people off to. And we need them fully functioning for that, as opposed to maybe burdening them with another responsibility and kind of crafting something new. And then that way, I think we can also manage it as the city. It ties in well with 911. They work well with police and fire if necessary. And it's not a whole other thing. So those are my